Right now, millions of Americans are stepping up to care for a loved one, but often at a personal cost. A new study from Edward Jones is shedding light on just how big that cost can be, financially and emotionally. Joining us now to talk about it is Vanessa Okwuraiwe, a principal at Edward Jones. Vanessa, we really appreciate you taking the time to chat with us about the latest caregiving study. Can you start maybe by telling us why this research is so important?
Yes, thank you very much, Michelle. Pleased to be here. Well, we have thousands of interactions with our clients every day, and so we know what their most important concerns are. The reason we decided to do this study was to have a more in-depth understanding of what the financial concerns, the emotional strains are for people who are caregivers, and we're seeing that number increase as more Americans live longer. It was important for us to be able to understand that and provide the right resources to help our caregivers play this very crucial role in our communities.
What financial and emotional concerns are caregivers dealing with right now?
Well, over 90% of people say that they do have a financial concern as caregivers as they think about their future. Many are stepping out of the workforce. Some are completely reducing their hours. Others are dipping into their savings, taking on debt. And so we all know that this creates some financial insecurity for their own personal retirement goals. We're also finding that caregivers are going through this emotional strain where they feel burnt out, they're feeling stressed, higher levels of anxiety amongst caregivers, higher levels of depression, which of course is having this negative impact on them mentally and physically. This is juxtaposed with, or juxtaposition, I beg your pardon, with people having this sense of gratitude or personal fulfillment about being a caregiver. So they really want to be able to care for their loved ones, but they're having all these other challenges. And all of this can be true at the same time, which is why we just need to find the right resources to support them.
What resources are available to caregivers to provide additional support, whether that be financial preparation or workplace flexibility?
Yes, well, so Michelle, let's start with the financial preparation. We would encourage everyone to consider talking to a financial advisor that truly gets you and can guide you over the course of your own financial future. So finding the right financial advisor is important because they will help navigate across Medicare provisions, finding the right counselors, putting you in touch with the right homes or residential facilities, and more important, putting together a plan for you. The other thing that needs to be considered is employers. How can employers ensure that they're providing the right support in flexible working arrangements or even paid leave? We all know if one has an uncle that has cancer or dementia, or a mom or a grandma who's battling something or the other, they have to pop out and look after them. So providing the right type of flexibility in the workplace is really important. And last of all, is government legislation. Over 70% of Americans support bipartisan legislation that allows caregivers to save more, especially for those who stepped out in order to care for loved ones. It allows them to build up additional savings that can provide that important peace of mind so that they've got their own oxygen mask on first as they care for their loved ones.
Boy, this is really good information. Where can we go to learn more?
edwardjones.com/caregiving will be a great starting point. We have a host of resources that can really help people get started when it comes to thinking about their plan for being a caregiver or receiving care in a later point in life. And the time to start is right now. Be prepared now with a plan will be what we would encourage.
Thank you, Vanessa, for joining us today. We appreciate it.
Thank you, Michelle.